Hi, my name is Dr. Brian Mailing, and I'm going to be answering your questions today from Reddit about stem cells and regenerative medicine. So I got a bunch of interesting questions here, and I'll try to get to all of them. Can stem cell injections restore brain tissue? So that's an excellent question. So we started our stem cell experience basically in Wuhan, China, at a hospital that specialized in brain surgery and neurologic conditions. Their experience included a lot of neurologically injured patients, stroke, spinal cord injury, also diseases like multiple sclerosis, conditions like cerebral palsy, things like that. So they had a lot of experience with neurologically injured or compromised patients. And they were seeing these dramatic results with cord blood stem cell treatments, basically taking the stem cells harvested from cord blood and injecting it both intrathecally and IV. And so my friend Eddie Amarante and I stumbled on Dr. Wu in this clinic, and we couldn't even believe it. So we decided we would start bringing patients to the United States. And one of our friends had a C6 quadriplegic injury, and she was 14 years out from her injury, and she did the treatments, and she had a significant, substantial, almost immediate improvement. So we thought, this is incredible. So we started writing up the research. We did publish a paper on spinal cord injury, and in fact, 80% of the patients had return of bowel and bladder function, which is pretty dramatic. Similarly, with stroke, we were able to document significant improvements in stroke patients that exceeded what you would normally expect to find in a stroke patient population. So we can't really prove that the stem cells cause the brain tissue to restore itself. We can just measure the results. So that's kind of what we've been doing. One of my friends that started the company with me, Eddie Amarante, had a really severe head injury. He's done a bunch of stem cell treatments, and he's had a dramatic improvement. So again, we can't really see clearly the results other than the patient's improvement as far as function. So we can measure the function, but we don't know exactly how it works. So I believe that yes, stem cell injections can restore brain tissue. Obviously, we're not going to just biopsy somebody's brain to see if the tissue's been restored, but I suppose with some imaging techniques, we might be able to see some improvements there, but definitely we can see improvement in function. Okay, so the next question is, preparing for my first stem cell injection 3 years after surgery, any advice? A person was suffering from a spinal cord injury. So that sounds great. Advice, I would recommend definitely checking to see if they have any published research. Where are they getting the stem cells? Do they process their own stem cells? What's the viability of the stem cells? How many mononuclear cells are you getting? When someone's doing cord blood stem cells, basically it's really difficult to measure the actual number of stem cells because they look the same on the microscope as basically other cells. So you can measure what's called colony forming units, which means you culture the cells and you see how many colony forming units you get, and you can extrapolate the number of stem cells from that. But what's easier is just to mention the total number of mononuclear cells. So those are cells with one nucleus, and that gives you an indication of how many stem cells there would likely be in the dose. So we typically use doses that have at least 400 million mononuclear cells. What seems to be more typical across other stem cell providers are doses more in the range of 25 million. So in our experience, that's just not enough to get a significant effect, and you really need to have that larger dose of more like 400 million or more cells to really see a significant effect. So we've also had really great experience with spinal cord injury. The other big thing you want to know is how are the cells being administered. If you're just getting an IV infusion of the stem cells, then probably not very many of those stem cells are going to get into the central nervous system. And if they don't get into the central nervous system, then you're probably not going to have a very significant effect. So what we do to get more cells into the central nervous system is do an intrathecal injection to directly inject the stem cells into the cerebrospinal fluid with a lumbar puncture. Another way to do that is to give a drug called mannitol, which is the sugar found in milk, intravenously before dosing the stem cells. And that opens the blood-brain barrier for a little while and allows more of the stem cells to get into the central nervous system. So when you're treating spinal cord injury, I think the first thing you'd want to know is, do they have any published scientific research, peer-reviewed scientific research? If they do, certainly you want to read it. What kind of dose are they going to be using? How are they going to get the stem cells into the central nervous system? Are they going to be using either mannitol or like a lumbar puncture or a direct injection into the area of injury? Also, do they have a lot of experience with this? What are their success rates? So we have a published research paper on it where we looked at the results of 90 patients that had spinal cord injury and were treated with stem cells. So we have a lot of experience with spinal cord injury, and we've seen really great results, and we have peer-reviewed published research specifically on spinal cord injury. Thanks very much. I really enjoyed answering everyone's questions today. So if you have any additional questions or comments, anything I could clarify more, just leave it in the comments section or send me an email. Thanks very much.